My name is Dr. Victoria Mountford. I'm a clinical psychologist, and I have been specialising in working with people with eating disorders for about 20 years now. So a little bit about me is that I am originally from London, where I worked for about 20 years in the NHS working with people with eating disorders. So to say a little bit as well about Maudsley Health. This is the organisation I work for now. We're based here in Abu Dhabi, down in Khalidia by the Corniche, and we're also based in Dubai. And here I head up the eating disorder service, where we see people with eating disorders, concerns about their eating, concerns about their body image, right across the lifespan. Also within Maudsley Health, we have a child and adolescent mental health service and an adult mental health service. So we kind of cover a whole range of difficulties. So as Sally said, Jazor is a mental wellbeing initiative focused on connecting minds and creating a platform where we can connect, share and heal together. There are these live sessions which focus on mental wellbeing and overall mental health. And the aim is to create an online platform that's dedicated to celebrating the journey of brave individuals who've overcome their mental health challenges. And here is the number that Sally was talking about just now, so the National Mental Health Support Line. So one of the things that I often think is most useful in these kinds of talks is giving you the opportunity to ask any questions, anything like that. So within the talk today, I'm going to start by explaining what is an eating disorder and who might be affected. I'm going to talk a little bit about how do eating disorders develop, because that's often something that people ask me. I'm going to think about what does treatment look like. Again, people can often be quite worried or quite cautious about treatment or what's going to happen. And then I'm going to broaden it out and think a little bit about things that relate to all of us, not only people with eating disorders. So how does social media affect our body image? And then some top tips for patients and their families. But as I said, I always think it's really valuable to have lots of times for questions. So I'll make sure there'll be lots of times. If you want to put your questions in the chat, then Sally will be looking over those and we'll discuss those at the end of today. So let me start by thinking about what is an eating disorder. One of the things that's really important to stress is that they are serious mental illnesses, okay? They involve a lot of distress and concern for the person and for their family. What we often see on the outside is that someone has extreme concern about their shape and weight, and that leads them to engaging in all kinds of disordered eating and behaviours. But what's really important to emphasize is that eating disorders aren't all about food. What's generally happening is that the person is experiencing a lot of pain, sadness, and worry. And their eating disorder is their best way to cope at that moment in time. Now, eating disorders can range from being really quite mild to very severe, and indeed life-threatening. So one of the things that's really important is that it's important to treat the eating disorder as soon as possible to avoid it becoming a chronic problem. I think sometimes there are some myths out there that you can't recover from an eating disorder, and that's absolutely not true. I've worked with lots and lots of people who've gone on to recover and live lives that haven't been affected by their eating disorder. But we do know the longer you leave it, the harder it can be. So what are the signs of having an eating disorder? There are many, many different signs, and often people have a range of these different symptoms all kind of coming together in different patterns. But I think one of the things that we most commonly see is that that person's personality really changes. So they might become much quieter, they might become to isolate themselves, they might be more irritable than usual. So I think if you're here and you're worrying about someone you know who you think might have an eating disorder, that's often one of the things that we really notice. The person with the eating disorder will probably find that they are completely preoccupied with food, that they are thinking about it all the time. So whether they're worrying about what they've just eaten, whether they're thinking about their next meal, and they will be experiencing lots of guilt after eating and worrying about losing control around food. What we might see is that that person begins to diet or skip meals. They might be counting calories. They might be trying to eat alone a bit more. And if they're embarrassed by what they're eating, they might be, again, eating alone or trying to hide that, eating in secret. What we might see physically is frequent changes in weight. So it might be that someone loses a lot of weight. It might be that their weight tends to go up and down quite a lot. And alongside that, we might see someone losing their periods or finding that their periods become more irregular. What we often see for some people is vomiting after eating. So this might mean that you notice lots of frequent trips to the bathroom during meals. But again, this will be something that someone is doing to try and manage how they feel about their eating. Alongside all of these things, the person with an eating disorder often has lots and lots of worries about their shape and weight. And that might mean that they're asking for lots of reassurance. Do I look fat? They might be engaging in lots of checking, so spending time looking in the mirror, weighing themselves, comparing themselves to other people. Or they might be at the other end of the spectrum and kind of be wearing baggy clothes and trying to avoid thinking about their body as much as possible. We also see some differences in the way that people eat. So people might begin to eat very slowly. They might have to eat their food in a certain order or separate it out. Or they might start using lots and lots of flavorings or spices to try and give the meal some flavor. We also know that some people get into other behaviors like exercising excessively. So becoming very rigid about what they have to do and getting very upset if they can't do it. So you can see that there are lots of different signs of an eating disorder. And who might develop an eating disorder? It can actually be anyone, regardless of their age, their gender, or ethnicity. What we know is that there's often a sense that it's going to be young girls, but actually it can be people of any age, and increasingly males are coming forward for treatment. I would say that generally the most common time for people to get diagnosed is between about 15 to 19, although we can see children much younger developing an eating disorders, and we also see a number of people who develop their eating disorders in their 20s. So now I'm going to explain a little bit about the different types of eating disorder. I often get a lot of questions about this, and people are often not quite sure about their diagnosis. One of the important things to say is that often people move between different diagnoses. So how the eating disorder presents will change over the course of someone experiencing that eating disorder. And often when you come for treatment, what I'm much more interested in is how these things affect you rather than the particular label or diagnosis that we give you. However, the one I guess that a lot of people have heard about is what we call anorexia nervosa. So this is when a person has an intense fear of weight gain. And that means that they engage in lots of behaviors to try and control their weight. For example, dieting, restricting, possibly vomiting or excessive exercise. And this means that the person will be significantly underweight. We also have bulimia nervosa. And in this diagnosis, someone will be probably in a healthy weight, a normal weight. What happens is that they're also very worried about their weight and shape. So they will make strenuous efforts to diet, to control their weight. But that sets off a pattern of binge eating where they lose control over what they're eating and end up eating a large amount of food in quite a short period. Because they feel so worried about that or so guilty, they will then try and undo that or compensate through vomiting, misusing laxatives or diuretics, or engaging in restriction or excessive exercise. Someone with binge eating disorder also engages in binging, so loses control over their food, but they don't tend to use any of the compensatory strategies that I've just described. So that may mean that they tend to be more in the overweight weight range. We then have a relatively new diagnosis, which is avoidant restrictive food intake disorder, or ARFID. And this is quite unlike other eating disorders in that a person with ARFID doesn't have any worries about their shape or weight. In fact, they're often quite embarrassed because they feel they're too skinny. But someone with ARFID will have a feeding or eating disturbance that leads to a kind of ongoing failure to thrive. So if they're a young child, they won't be growing taller. If they're more of an adult, they'll be losing weight. And this is usually linked to one of three things. So either they find the sensory characteristics of food quite disturbing, they're just not interested in food, or they've had a previous aversive experience like maybe choking or some bad food poisoning, which has made them very scared of eating again. We often see ARFID in young children, so it's quite similar to what we might call selective eating. And finally, we have something called other specified feeding and eating disorders, or OSFED. And this is kind of when we see a variety of these symptoms all together, but they don't really meet criteria for any of the other disorders. So one of the things I often get asked is, why do eating disorders develop? And I think the best answer is that eating disorders are very complicated, and there are many different factors that contribute to someone developing an eating disorder. It's never just one thing. So up here, we've got a few of the different factors. So for example, we know there are genetic factors implicated in eating disorders. So if you have a relative with anorexia or bulimia, it's more likely that you yourself might develop an eating disorder. There are also things that tend to affect the brain. So when we binge or purge or get in starvation, it alters the brain chemistry and changes our ability to regulate things like hunger and satiety, and that actually keeps the eating disorder going. One of the things we also know is that starvation tends to shrink the brain. So the longer the eating disorder goes on, the more starved the brain is, the harder it makes things like managing emotions, managing social situations, making decisions. So all of these things serve to perpetuate the eating disorder. There are also a number of developmental factors. So as I said just earlier, the most likely time to develop an eating disorder is in adolescence, when you're a female. We also know that there are a number of personality traits, like being a bit of a perfectionist person, being sensitive or anxious, that might make you more likely to develop an eating disorder. As does having kind of early childhood eating problems. If there are lots of difficulties around at home when you're growing up, that can also increase the risk, as can, having that experience of being bullied or teased, especially about your appearance. We know as well that there are many influences from TV, from social media, from peers, which all give us messages about it might be important to look a certain way. When it comes to bulimia, one of the biggest risk factors for developing bulimia is starting to diet. So often people who do a bit of dieting or try and control what they eat might be at greater risk of developing an eating disorder. Young people who've maybe previously been overweight may also be at risk. And again, then there are general things that happen for us all, like stress, exams, bereavement, moving, parental separation, abuse. That can make it, again, make us more vulnerable to developing an eating disorder. And then if we have any kind of hobbies or careers like ballet or modeling that have a particular focus on the way that we look or managing our weight, that can also increase risk. But as you can see, there are kind of many factors that feed into people developing an eating disorder. So it's never possible to say who's going to get an eating disorder or why they got it. And everyone who develops their eating disorder is different and has a different reason for their eating disorder. But often we can kind of see some patterns. So when you talk to many people who have an eating disorder, one of the things they'll say is that it helps them give a sense of being in control. And this can be particularly true if people feel that other things in their life are going out of control. So one of the things we've seen with the pandemic and lockdown is that life has suddenly really changed and things have become really out of control for most of us. So for example, there will be a lot of young people who suddenly weren't attending school anymore, weren't seeing their friends, and that gap in time probably left a lot of space for the eating disorder to flourish. Often eating disorders are about helping to manage emotions. So when we lose weight, what that does is tend to switch off our emotional system. So a lot of people will talk about feeling quite numb. And sometimes that can be preferable to feeling really worried about something or really scared. We also know that when we binge or purge, that can also help block out emotions or give a big sense of relief. So again, people who engage in those behaviours might also find that that's helping them to manage their emotions. What's really important to say is that eating disorders aren't about vanity. That's often one of the reasons people feel that they shouldn't come and seek help, because people will just think they're vain or self-obsessed, and that's absolutely not the case at all. One of the things we know is that often people with eating disorders experience a lot more stigma than any other mental health disorder. And that can make it really hard to open up or to seek help. And equally that often a person with an eating disorder is very critical of themselves. So they will be critical for needing help or for not being able to get better quick enough, or not even, sometimes people don't even feel like they're good enough at their eating disorder. So often the person with an eating disorder is really worrying about a lot of things and is feeling really torn about seeking help and allowing themselves to have someone to care for them. So what happens if you have an eating disorder? I think one of the things that makes eating disorders so difficult is, as well as affecting your mental health, they have severe and serious impact on your physical health. So and in fact, lots of different areas of life, actually, eating disorders affect everything. In terms of your physical health, what eating disorders can often do is slow down your heart rate. They can lead to lots of gastrointestinal difficulties, so bloating, constipation, nausea, delayed gastric emptying, so feeling full for a long time. Often people will feel very tired, very cold. They might experience dizziness or fainting. They might have problems sleeping. Being underweight can have significant impact on your fertility and your bones. Also, I think it's really important to say that it's not just being a low weight that makes eating disorders dangerous. If you're vomiting a lot or using laxatives or over-exercising, those can also have serious impacts on your heart. When you come to a clinic, often the doctor will ask you to have some physical checks and your blood tests. That's because we're trying to assess and monitor all of these things. Eating disorders also affect people emotionally. So the person is likely to experience lots and lots of anxiety. they'll be more depressed, they might be irritable, and they might find that they've just kind of lost interest in all aspects of life. They don't want to see friends anymore. Things that they used to enjoy, they no longer enjoy. One of the things that eating disorders also have a big impact on is our ability to think. So this is really important for people who have a job, people who are at school, and often a lot of our patients will be studying for exams. And it's really important to think about how these things can impair their ability to do well, or mean that they have to work a lot harder to get the same kind of grades that they would before. So often people talk about their concentration being really affected. They might have to read the same page several times. They're not as alert. Their thinking is much more rigid, so it's harder to be spontaneous, it's harder to problem solve. So this can have a really significant impact. Again, there can be lots of social impacts. So one of the big things I think is strained relationships at home. It's obviously incredibly difficult having an eating disorder, but it is also incredibly difficult watching a loved one with an eating disorder. So sometimes parents or friends or loved ones, partners, can really worry, what should they do? Should they have a fight? Should they overlook it? How can they manage to best support that person? They, can be really, really worried watching this person visibly lose weight in front of them, and just that can lead to lots of arguments and lots of anxiety. The person themselves may be feeling quite isolated, may withdraw, may feel that they struggle in social situations now, that they're not good enough, and that can lead to peer difficulties and difficulties at school. As I mentioned earlier, there can also be a huge impact on your attitude to food and eating. So you might be thinking about food all the time. You might have to have everything meticulously planned out. So what you're going to eat, when you're going to eat it, if something goes past a certain time, it might cause huge anxiety. On the other end of this is that there might be times where you lose control of your eating and you end up eating lots of food in a very short space of time. So this then can lead to guilt or shame or worry, and thinking that you need to try even harder the next day. Sometimes people tend to hoard food, so saving it, eating it out very slowly. And you may find that people tend to eat very, very fast or very, very slow. And a meal that would normally take half an hour now takes an hour and a half. So there can be lots of changes in people's eating behaviour. What does treatment look like? When we think about treatment for children and adolescents, obviously it slightly depends what age the young person is, how mature they are, that kind of thing. But at the beginning, one of the most important things is on resuming normal eating and restoration of physical health. A lot of the impacts that I described just now will go away when someone begins to eat regularly and gain weight. And especially in younger children and adolescents, the approach is a family-based one in which we support the family, the parents, to regain their confidence in feeding for and caring for their child. Some individualized approaches might be more appropriate for some older adolescents. Like I said, it depends. But I think whatever the age, it's often helpful to have family or flatmates involved, negotiated with the patient, because these are the people who see a lot of what's happening and are there to support that person. In terms of treatment for adults, in many ways it's very similar. So first off, we focus on normalised eating, gaining weight if that's necessary, and improving health. And then psychological therapies that address the factors that led to the eating disorder starting or that keeps it going. And two of the leading evidence-based treatments are cognitive behaviour therapy for eating disorders and the Morsi anorexia nervosa treatment for adults. So I've been involved in developing both of those and have delivered them both for many, many years. And we know that they're both very effective in treating people with eating disorders. So I'm going to switch now and just say a little bit about social media. Again, because one of the things I often get asked is, Is social media making eating disorders worse? Can it cause them? So they don't make eating disorder, they can't cause eating disorders. Like I said earlier, there's lots and lots of factors. And we're all on social media. So if they cause social media, many, many more of us would have eating disorders. But they can be a big factor in fueling anxiety about the body, weight and shape. And we all know how easy it is to get caught up on social media, to become overwhelmed with unhealthy messages by following certain sites and feeds, okay? So, and we also know there's lots of things about social media. It makes it much more likely that we're going to compare ourselves to others, that we're going to look at images that have been filtered and tweaked, but maybe not take that on board in the way that we should, so we still compare. And if you have worries about shape or weight or body image, it's a really good idea to have a sit down and have a think about how you use social media. So one of the things we often do is say, you know, for a day, just monitor how much time you spend on your app. What kinds of things are you looking at? How do you feel after you've looked at something? So do you feel better or perhaps more anxious? And could you have spent this time doing other things? So one of the things about social media is it's a very passive thing. We often spend lots of time and just comparing back to ourselves. Whereas if we're engaging in activity or seeing friends, you know, that's a much more kind of in the moment. It probably gives us a lot more positive feedback than spending time on social media. And if you're interested, there's a little booklet that I developed alongside people with eating disorders at my old place of work, and there's a link to it at the end. But it's a bit of a guide just to help you think about your social media use. So often I think it's useful to have a discussion, you know, with a parent or a friend or your therapist about what you use on social media, how much time you spend on it, to be really honest with yourself and say, what's an unhelpful app, or what do I follow? Who do I follow that's not helpful? And delete those. Instead, see if you can find positive, funny or inspirational people to follow. I would say ideally things that aren't connected to food, shape, weight or exercise. So who are you interested in for other reasons? And then you can set up some experiments to look at your mood, your body satisfaction and your anxiety when you do and don't use social media. Try having a day where you don't use it and see how you feel at the end of the day and what you've got done. This can be a really useful way of just making a decision about whether it's something that you want to keep in your life. And I think just to kind of put this in context, what often happens when it comes to negative body image, whether or not you have an eating disorder, you know, lots of people without eating disorders will still worry about their shape and weight. Something happens. Maybe you see something on social media, maybe someone says something, maybe you're just sitting thinking in your bedroom and you'll have a negative thought about your body. Because this is something that's really worrying you, you begin to focus on this thought. And that sets off perhaps anxiety, guilt, or disgust. And then you get caught up in comparing yourself to other people or how you looked in the past. You might start checking your weight, or you might go into avoiding, you might get on social media. And what happens when we do all of those things is that we end up feeling worse, and that just perpetuates the negative thoughts about our body, and that just keeps going round in a bit of a spiral. So what we often want to do is think about, how can I accept my body? What can I do differently to try and break this cycle? So under the Red Cross are some of the things that we know that tend to keep negative body image going. So like I said, checking your body or weighing yourself frequently, comparing to others, or at the other end of the scale, avoiding everything, following people because of how they look. So try not to follow people like that. And also try not to mind read what other people are thinking. So it's really easy for us to get into the habit to assume that other people see us the way we see them, or the way we see ourselves. But actually most people don't really, once after the first time they've met someone, don't pay that much attention to appearance. They're thinking much more about who you are as a person. We also, like I said at the beginning, we all tend to be much more critical of ourselves than anyone else. So it's, again, likely that you're having a much more critical thought than anyone else is having. But what people often ask me is, how can I be kinder to my body? How can I accept myself more? One of the things that I think that we are really caught up in life is kind of thinking about our body and how it looks like. And that means we forget all the amazing things that our body does for us. And if we can start thinking about things like that, the fact that it enables me to get to work, it enables me to do the sports that I enjoy, it enables me to give someone a hug, it might enable us to have a baby, all kinds of things like that. Our body is amazing in terms of, you know, what it can do, in terms of healing itself, looking after itself, regulating temperature. If we think about all of the things it can do, that can really shift our perspective on it. Often people who are concerned about their bodies can get going to the gym in quite a rigid way, and it becomes much more focused on burning calories or losing weight. And again, one of the things that we really advise is, as long as you're not significantly underweight, getting into a team sport or activity. So doing something with other people. This helps us see a whole range of bodies and makes us realize that many, many people out there don't have a perfect body. Again, it also helps us shift our goals. So actually my goal for my exercise isn't about losing weight. It's about, you know, improving my forehand in tennis, getting a faster time when I'm kayaking, or, you know, a team sport, playing well on my team if I'm playing basketball or something like that. So when we make it about a team sport, it becomes, we set different goals, different values. It also means that then we are not kind of going to get caught in the gym for hours and hours. We're doing this as part of an activity with friends. Imagine how you would talk to a friend. What would you say to them if they worried about their body? Use social media wisely. Care for your body, including your health. So as well as what's on the outside, what's on the inside? Are you going for, you know, hospital or dental checks when you need to? Are you using moisturizing? Are you using SPF if you're out in the sun? Are you drinking enough water? Are you giving yourself good nutrition? Are you caring for your whole body, not just focusing on how it looks? And finally, I think, look for role models. Who do you know? Who do you feel has a compassionate, positive attitude towards their body? What can you learn from them? And also your values. So what's important to you in life? You know, is the most important thing that other people around you think, oh, she's thin or she looks good? Or are there other things about being kind, being successful, having a career or a hobby that you really value that are actually more important to you? Spending family time, being able to concentrate on your family rather than worrying about how you look. What are the things that are really important to you? Often when we can turn our focus to those values, we become less worried about how we look. So what if you're listening to this now and you're thinking, I'm worried about a friend or I'm worried about someone I know? So one of the things to do is to gently raise your concern away from meal times. During a mealtime, the person is probably already very anxious or very distressed. It's not going to be a good time. I would often focus on how they are feeling rather than what you've noticed about their food or weight. So you might say, I've noticed that you seem much quieter than usual. I noticed that you seem to have a lot of worries or you seem a lot sadder. And see what they say. Don't list everything that you've noticed. That's likely just to make them feel quite defensive and on the back foot. But depending on the severity of the issue and how old they are and whether you're a friend or a parent, if they're not ready to talk, you might want to leave some information. If you're a parent and you're really concerned, you might want to approach a professional and they can think about how to help you get your child some help. But don't leave it too long to talk again. Remember what I said about trying to get help early. If you're listening to me and you think you might have an eating disorder, how do you get started? Talk to someone you trust, get your physical health checked out, make an appointment at a clinic. And here are just some websites that people often find really helpful. And that book on social media, the booklet I recommended earlier, is on the www.freedfromed.co.uk website. And then this is also a self-help guide that I co-wrote with some colleagues. It has some information for carers and some information for people experiencing an eating disorder as well. So that also might have some things in that you want to look at. And it also talks about what happens if you want to start getting professional help and what you should be looking for. So here are my top tips. Try to talk to trusted people about how you are feeling instead of bottling up those emotions or using food to try and squash them down. Challenge your inner critic. Ask yourself, would I ever say this to a friend? I think the answer will probably be no. Remember that no recovery is like a straight line or perfect. If you have a bad day, that's okay. Just try and get back on track as soon as you can. Regular eating is one of the major first steps to recovery. People often feel very anxious about this, but it brings such benefits. Live the life you want now. It won't suddenly appear at a magic weight. So a lot of people say to me, if I just get to X weight, then it's okay. I'll stop dieting, or I'll stop doing these things, or I'll leave the house, I'll start doing things. You need to start those things now. Though it's the weight that's holding you back, not those things. So live the life you want now, and you're much more likely to be happy and healthy. For family and friends, like I said before, it can be really, really stressful having a child or a loved one with an eating disorder. So make sure you have your own support network, whether that's a friend, whether it's a professional, your partner, or whether you follow support networks online for parents of people with eating disorders. That's really, really important. Try and step back from comments that the person might say, such as, am I fat? This often is kind of a bit of a decoy. Actually, what is the person really trying to say? They're probably trying to say, I'm feeling really worried about something. Often when someone who is profoundly underweight says, am I fat? That can lead to us to feel a bit frustrated. Actually, if we can connect with the feeling underneath it, it's far more likely to have a productive conversation. Everybody is different. So the best thing to do is to ask your loved one how you can best support them. What do they need from you? We often try and give compassionate responses. You know, so I'm so sorry that you are feeling fat, or I'm so sorry that you're telling me that you really can't eat this now. However, we need to make sure that you do eat whatever is on your plan. We need to do this for your health. It's obviously very easy to get into fights in this situation, but we find that trying to acknowledge how the person is feeling and then giving very clear, not emotionally loaded guidance about what to do next is the best thing. Don't assume you know how they feel. So you might be really excited that they've gained some weight or they're eating a new food. They may be feeling absolutely horrendous. So don't make an assumption. And I would always say seek professional help. So I just thought I'd give a little example to kind of bring this to life. So this is someone I've worked with. I'm going to call her Amira. That wasn't her real name. But when I first met her, she was skipping a lot of meals, she was vomiting and exercising a lot. And what had happened was that she'd lost quite a significant amount of weight, her periods had stopped and her hair was falling out. Now, Amira was really, really scared that if she started to eat, if she started to gain weight, she wouldn't be able to stop and she would end up overweight. This is a really common fear amongst people with eating disorders. and it's exacerbated because she had recently started binging, which had terrified her. Now, often when people lose a lot of weight, they will start binging. This is the body's way of trying to get back to normal. But of course, for the person with the eating disorder, it's terrifying, and it makes them often try and seek even greater control. So through treatment, she was able to understand that lots of her thoughts and behaviors, things like the binging, were normal responses to starvation. So it wasn't a lack of willpower. It wasn't anything that she was doing wrong. It was a sign that her body was giving her that she was significantly underweight and in starvation. And even though she didn't believe it at first, the more she could return to a regular pattern of eating, the more control she had. So thinking about food all the time went away, the binging came down. And when this happened, she was much more able to get her life back. That's the other thing we do a lot of in treatment, is thinking, how do we get your life back? One of the things about eating disorders is they often squash your life and make it very small. And then following that, we began to work on how she felt about her body image and her self-esteem in general, working to improve those things, build her confidence, and to keep her going in that life without an eating disorder. So I've just got a couple of other resources before we go for some questions. So the UK National Eating Disorder Charity has lots of helpful information on it, and that's www.beatingeatingdisorders.org.uk. Eva Musby is a parent of a child who had anorexia, and her website has lots of really useful information. She has a book as well, but it also has lots of little animations that kind of show you what to do if you're trying to feed your child and your child is not eating. And then also the Middle East Eating Disorder Association is at mida.me. So thank you very much for listening now. I see that we have some questions, so I'm just going to stop this part of the screen.
We have lots of questions, yeah. Okay.
Sally, go ahead.
Yep. I'll start asking you the questions and you can answer them. We have one question or comment from Dean in the chat. How can I tell the difference between an eating disorder and a temporary state of mind or actions?
So that's a really good question. Normally, for something to be diagnosed as an eating disorder, it's been present for 3 months. So people often have cycles within that. So they might have a week where they feel a lot better about things, and then a week where their eating seems to deteriorate. But if you've been kind of experiencing this overall for 3 months, that would suggest that it's become more of an ongoing problem rather than just a temporary problem.
Okay. We have another question from Muna in the chat. How do you think racial groups can have an effect on people with eating disorders, and can a damage to brain be reversed if one recovers fully?
Okay, so I'll start with the second one first, just to say, yeah, absolutely. If you can recover fully and restore weight, then very much all of the difficulties that you're experiencing will go away. If we're thinking about someone who's had an eating disorder for a really long time, so I would say over 20 years, it might be harder for some of those things to be reversed. But definitely, if we can get in relatively early and help that person restore nutrition, then they can all be reversed. In terms of different ethnic backgrounds and eating disorders, there are, anyone can get an eating disorder, but we do tend to see some differences among different racial groups, and that can be in part down to cultural factors. So for example, among different groups, there might be different preferred body types, different emphasis on eating, different cultural practices. So we can see variation, but it's doesn't mean that someone from a particular ethnic background will never experience a certain type of eating disorder.
Okay, so I think this is a follow-up from Muna. She says, what about 8 years?
Sorry, what about?
A period of time, and I think she's been suffering.
Okay, I see. So yes, so we could definitely, I think, it's obviously very hard for me to say without knowing you in person and knowing what's been going on. But definitely after 8 years, I've worked with lots of people who've had that eating disorder for that long. They can fully recover and make a lot of really, really positive changes. One of the things that can be a bit different is bones. So depending how underweight someone's been, how long they haven't had their periods for, we may see some signs that the bones are a bit thinner than we would like them to be. But what I would say is really important is that it's never too late to seek treatment. And it would be much better, even if you've had your eating disorder for 8 years, to seek treatment, to make changes, than to go on and have it for another 8 years. So I hope that's encouraged you to think about change, because I would really, really recommend that.
Perfect. Another question. Am I considered to have an eating disorder if I count calories for everything I eat every single day?
Okay. So I imagine if that's what you're doing, there's probably other things that you're doing as well, which would fit into whether or not you have an eating disorder. So how we kind of think about an eating disorder is, does someone spend a lot of time thinking about food? Do they try and control their eating? And are they really distressed by it? So is it having a really negative impact on their life? And if you're feeling that you're quite controlled by having to count calories, if you're kind of avoiding events or changing what you're eating because you feel like you've gone over a calorie limit, that would suggest that you definitely have serious concerns about your eating, and there might well be an eating disorder present.
Another question. Do men or women, boys or girls, react differently to with their eating disorders?
Yeah. So while we've got lots of research on how females present with eating disorders, there's generally less research into men. What I would say from my sort of clinical experience over the years is that some men present very much in a way that they want to be, if they have anorexia, they want to be as thin as possible. They're very anxious about gaining weight. Other males may have more of a focus on being muscular and lean at the same time. So there can be some differences. Often for men, it can be harder because it feels like there's more stigma. Eating disorders might be seen as a female disorder, so there's then kind of more challenges to masculinity, feeling like a man, if you feel like you've developed a female disorder. Over recent years, there have been a number of prominent men who've come forward and spoken about their eating disorder, and I think that's been really helpful in terms of challenging stigma and helping people to understand that men can have eating disorders, men and boys can have eating disorders too.
We have a comment from Alia. She says, sometimes I think I want to get an eating disorder just to become thin.
Okay. I think that many people with eating disorders would tell you that you definitely don't want an eating disorder. Eating disorders are illnesses that destroy people's lives. They have a huge impact, and they create incredible amounts of distress, and they really impair people's lives. I think what we would think about instead is why do you feel that it's so important to be thin? And like the slide I had about accepting your body, it might be, can you do some work on accepting your body and liking yourself more? Because I don't think that, even though we get lots of messages from the world around us that it's really important to be thin, actually there are more things in life.
Okay, so Nick has two parts or a question in two parts. First one is, what about 12-step program like OA?
Yeah.
And the second question is, thoughts on intermittent eating to control weight.
Yeah, okay. So one of the things about the 12-step program is, I suppose maybe what I should start by saying is that different things work for different people. And I'm going to talk about this in terms of the evidence base and what the recommended treatments are for people with eating disorders. So one of the things that we know about people with eating disorders is they tend to build up a lot of rules around eating, and it's breaking those rules that creates a lot of anxiety and often triggers binging. So programs like the 12-step program tend to be quite fixed and firm in what they believe that you should be doing. So that's kind of incompatible with the eating disorder treatment models that are recommended by the evidence base. So I would generally steer someone away from that. Obviously, there are people who have found them helpful, but that generally wouldn't be my advice. I think often the feedback I've had from people as well is that they can go, and there might be people who aren't really overweight who are there, or that there can be, I think for any self-help group actually, you need to be very careful about what the overall message coming from that group is. So is it as helpful as it should be? Again, intermittent eating, that may work for people without eating disorders to control their weight. I think one of the things about people with eating disorders is they've always got that added vulnerability for something to slip out of their control. And one of the key things that we know helps our physical health, our gastric health, and also reduces the risk of binging, preoccupation with eating, is regular eating. So again, depending on how extremely intermittent eating is, again, those things are going to be incompatible.
Okay. So we have, that's all the questions from the chat so far. We have some questions in the Q&A. First one is, I have body dysmorphia. I hate seeing myself. My friends say I have an amazing figure, but I don't see that. I'm disgusted by myself and I don't know how to see what other people see, even though that I try and love myself.
Okay. So I would say, it's kind of very similar to what I said earlier, that you might need to seek some help for that, or you might want to look at a self-help book to begin to think about how you can develop some compassion towards your body, because it is so difficult when you feel that way about yourself. And I imagine it probably interferes in so many aspects of your life, like friendships, relationships, work. It can be something that you're thinking about all the time. So I would definitely try and either look at some self-help books, the websites I mentioned, or seek some help. The website link that I put up for the Centre for Clinical Interventions has some really good workbooks on body dysmorphia. So that might be where you want to start.
I have suffered from anorexia and bulimia, and I have been working on getting a healthy mindset and a healthy relationship with food. However, diet culture seen on social media and everywhere around us is very triggering and have made me relapse several times. What steps can I take so that I'm no longer affected by this?
So first of all, I want to say well done for working so hard on your mindset, on your recovery. And also just to say that you highlight something that is so difficult and so prevalent in our society, which is diet culture. So one of the things I would say is try to look about if you can find some body positivity stuff on social media. Think about who you follow. There's a lady called Christy Harrison, I think, who's written really nicely about the anti-diet culture. think about immersing yourself in that. Also think about who you spend time with. So do you spend time with people who promote diet culture, friends at the gym, whatever it is you do? How can you either encourage them to change or move away from that? Yeah, because I think that's what you need to do, is to try and challenge the diet culture or build up a little bit of protection for yourself, so that it doesn't get in there again.
Okay. Another one says, I'm bulimic, but it helped me maintain a good weight. Short term, I see no side effects.
Okay. One of the things that research shows us is that over time, people with bulimia are far more likely to gain weight than people without an eating disorder. Putting the body through binging and purging disrupts our metabolism. What the body will try to do is to hold on to the food as much as possible. So it slows your metabolism down. And what we tend to see is people with bulimia lose weight, then gain weight, then lose weight, then gain weight, but overall it's a line like that. There are also severe impacts to your teeth, your heart, your skin. So even if you're not seeing your side effects now, what you're doing is incredibly dangerous. So yes, I think what you say may well be true, that in the short term, this feels like the answer for you. But I would be incredibly worried about the the short term, medium term, and long term. And I would really suggest that you seek help or work to address those things.
Okay. I've been yo-yo dieting ever since I gave birth, and that was more than 2 years ago. I stick to a healthy diet for a while, then slip back into a loop of overeating and yet gaining more weight. What can I do to stick to being healthy and loving myself? Do I need to see a professional?
So often when people say that they follow a healthy diet, when we look at it, we find it's actually quite restrictive. And it's hunger that then triggers you back into that loop of overeating. So I don't know for sure if that's what's happening for you, but that might well be the case. So given that this has been going on and off for 2 years, I would say, yes, see a professional, and that way you can have a talk about what's going on, and then put yourself in the best place to make sure you're eating enough, and then to challenge the other things that mean that you slip back. So it might be, obviously having a 2-year-old is incredibly demanding. Might be things going on in life that leave you quite stressed and overwhelmed, and then you're turning to food as a pick-me-up.
Okay. I can't stop eating sweets and sugar. Am I considered an addict, and what should I do?
So again, this is one that's really hard to address, because when you say you can't stop eating sweets and sugar, it's really hard to know exactly what that means. So I would think if some of the other things I've talked to you about today have resonated with you, I would seek some help. We don't really, people can't really be addicted to sugar in the same way that can be addicted to things like nicotine or heroin. It's often that we just feel that we need it. So again, I think maybe if some of the other things I've said have resonated with you, seeking some support might help you to get a more structured plan for how to address that.
And by support, you mean professional help, or like support of loved ones and close?
It probably depends how severe it is. But maybe looking at some information online, finding a self-help book as a starting point to see perhaps what you should be eating compared to what you are eating. Often people seek out sweet and sugar things, if they need a sugar rush. And also just thinking about, are these foods easily available at home? What happens if you change some of your behaviors? What happens if you try and have a piece of fruit instead?
Another one says, I've been stress eating a lot recently, and I find myself feeling ashamed a lot after binge eating. I always tell myself that next time I'm going to resist and be in control, but I spiral back into the bad habit. What can I do? I don't want to go too far.
Okay, so this sounds really a lot about kind of what I've been talking about. enough in the first place so that you're not going hungry, and look at what the possible emotional triggers are. You might want to think about using some of the self-help I've suggested, or seeing a professional as well.
We have another comment from Nick, who asked a question earlier about the 12-step program and the intermittent eating. He says, thanks so much, very helpful. Male aged 61. Sickness doesn't discriminate, as COVID is showing.
Yeah, absolutely. So, and often people who are maybe more mature might have had these difficulties for many, many years and sort of suffered in silence. So I would always encourage everyone to seek help. As I said, there are a number of males coming forward with eating disorders, which is raising the profile, but there are men who have, suffered for many, many years with an eating disorder.
We have a comment in the Q&A box. That individual says, I think it's important to focus on being healthy mentally and physically and eating healthy and love yourself, but also to be cautious not to cross the line and turn it into an obsession.
Absolutely. I could agree with that, yeah.
Okay, perfect. I have been relatively thin my whole life until my second child. It has become difficult to maintain my figure, which led to regular binge eating sessions due to frustration. Is this temporary, or is it considered an eating disorder? So
again, this is kind of one of like the first one where I was talking about how long it's been going on, and how much of an impact it has on your life. One of the things I would say is that if you've just had a second child, often we can feel lots and lots of pressure to kind of snap our body back into shape, whereas really it can take a year, if not longer, to kind of return to around about a pre-pregnancy weight. I don't know if you're breastfeeding or not, but that's also something that's going to have an impact on your energy. So I would just hold that in mind, whether you've been losing weight too fast, combined with breastfeeding, which has led to the binging, or whether you're putting too much pressure on yourself.
My younger sister, who's slightly overweight, have been suddenly skipping meals and on some days not eating at all. My family and I have tried talking to her and have urged her to seek professional help, but with no avail. What can we do as a family to help her?
Yeah. So again, this is very similar to kind of what I was saying in my top tips. I think just trying to be there for her, focusing on, are there other ways in life that she's unhappy? So not always going directly for the eating disorder first of all. And then that might be a way in, because often if you think about all the symptoms I said that come along, or the impact of having an eating disorder, often people don't put those together with having an eating disorder or restricting. So people will just feel sad. They won't want to spend time with their friends anymore. School will be harder. So I would see if she's got any of those other issues that you can kind of maybe find to open the door and then begin to have a conversation with her. But yeah, we know that it's very, very worrying when you're in that situation.
Yes. And I think for some reason, support from family members, close family members, is very important in such events. Yeah. Is there a directed audience for eating disorders?
So I'm not quite sure what this question means by directed audience.
Me neither. It's like a vague question. But is there a directed audience for eating disorders? I think what this person means is that is there, let's say, a certain age group, certain gender that should look out for eating disorders more?
They probably occur most frequently in adolescent females, but as we've just said, they can affect anyone from any background, age, gender, ethnicity, and often in something that's not the stereotype, they tend to get more overlooked and find it hard to get treatment. So it's really important that we're mindful of that. Should we do the next question?
Yes, sure.
Yeah.
How can we support a friend who I believe is currently suffering from an eating disorder? When trying to offer help and support, she would become very angry and defensive and would avoid me for several days.
So again, I think this falls under the question that I just answered. That it is really, really hard. Maybe speak to some of her other friends, see if you're if other people are talking to her as well. And I think just be there for her for when she's ready to talk. You might want to maybe send her a website link or something like that. But yeah, it's very, very hard. One of the things about eating disorders is often it's very difficult to help someone get better if they don't want to.
Okay. Are there any therapeutic methods that you would recommend for anxiety?
Yeah, so I would think about practicing some deep breathing, some muscle relaxation, some mindfulness, and some CBT. So there's quite a lot of good apps out there that will have techniques that can help with that.
And the last question is, why do I feel like a failure when I'm full and strong when I'm hungry?
So this question kind of feels like an eating disorder talking. That's something that I would very commonly hear from someone with an eating disorder. And essentially what happens when we get an eating disorder is, as well as all the signs, we get a whole different way of thinking in our head. So we call that kind of our anorexic thoughts. And those thoughts are often very disturbed and very distorted. And that's what that thought sounds like. So I think, to me, that's a sign that you're probably having a really difficult time, and that you must be worrying a lot about what you're eating and spend a lot of your time feeling guilty and anxious. So I would suggest seeking help. But to me, that's a sign of an eating disorder thought.
So we're all out of questions now and time because the times pass by fast. But I have like a question that came up to my mind right now. So basically, from all the questions that I just read and from your comments, I was thinking: is our relationship to food is more physical than mental, or the other way around? Like, is food a physical need, and should it remain a physical need, or should it be more something mental? Like, from what I just read from the questions, I feel that it's more like a mental issue, the relationship with food.
Our relationship with food is definitely an emotional, mental relationship. But the reasons why we eat food are many and varied. So a lot of the time we need to eat food because we're hungry and we need energy and we need fuel to get our bodies to work well. And we need a variety of foods so that we've got good nutrition. But also, we know that food has a huge social role in our cultures. So almost any special occasion will involve a very nice meal, some kind of feast. It will be special. So food is also a way that we bond with each other. That it's also how we show care by, I want you to come around and I've made this beautiful meal for you. We also know that, lots of food is very tasty and we enjoy eating it. And particularly, some of the foods that are there now are designed to be very Moorish. We have a bit of chocolate, we want some more. So food comes in at many different levels for us. There is that physical of, I need to satisfy my hunger. But then there are many other emotional levels where food is important, and often you might think about a certain food you associate with a certain person or a certain time or a certain place. There are foods that we go to for comfort. And none of those things are bad in themselves at all. I think what's really important to say is no food is bad. It's just our relationship to that food can sometimes be disturbed. So what we're doing when we're eating is it's a balance of all of those things. And often what happens for people with eating disorders is almost to focus on that. Something that is often fairly natural that we do without thinking has become very exaggerated and obsessive. So they are thinking deeply about everything.
Perfect. That answers up the question and it makes complete sense. I'd like to thank you, Dr. Victoria, for the wonderful time and the valuable information. This was a very informative yet entertaining session. Everything you said was like it hit the spot, and I'm sure a lot of people who are listening would agree. So I'd like to thank you very much for giving us an hour of your time. I'd also like to thank everyone who attended this session today and who also gave us an hour of their time to be here with us and support our initiative, the Jusur Initiative. Again, I would say that if you or anyone you know is in need for mental support, please don't hesitate to contact us on our mental support line on 800-HOPE. I just posted that in the chat for everyone to see. And if you'd like to know more about Mosley Health and you'd like to know more about their services, I've also posted their social media in the chat. So go ahead and follow them for more information. Thank you again, Dr. Victoria. This was wonderful. If you'd like to end with a couple of words.
Thank you very much. Thanks for all your questions, everybody. It was really interesting to hear them and just really to hear how difficult things are out there for a lot of people. A lot of people are worried about people with eating disorders. It is really, really tough thing to watch someone with or to experience yourself. So I would like to say I wish you all the best. I hope that today has been helpful and has maybe given you a few ideas about how you can move on from here. So thank you very much, everyone.
Thank you so much, and stay safe, everyone. These are difficult times, but we'll get through them together with the support of our loved ones. Thank you again, everyone, and have a lovely evening. Thank you.
Thank you.